Hi, it's Susie with another quick exercise tip. Now this month is April Falls. We're trying to increase the awareness of falls and your own falls risk and provide you with some strategies to reduce that risk. Now, before we get started with those strategies, it's important to be able to measure and be able to evaluate your own level of risk. So I'm going to show you 4 simple tests that you can perform at home, and they all look at slightly different elements of balance. Now the first 2 involve holding a position for a period of time. You've probably seen these tests being performed again. Now before we get into those, remember that with any balance testing, we want to make sure we've got a safe environment. So we don't want any trip hazards, and we want to make sure that we've got support nearby. So I'd recommend having a wall nearby or having a nice long corridor that has a wall on either side. They're ideal situations. So for the first 2, I'm going to make sure I'm next to my wall. The first thing I'm going to do is start with a single leg balance. I want to have my hands on my hips and I want to raise one knee out in front of the body, and I'm going to try and hold this position for 10 seconds or longer. So what we're looking for today is that cutoff for falls risk, and the Centre for Disease Control identifies that 10 seconds for both the single leg and the next position, which we'll do, which is a heel toe stand, is that cutoff point whereby falls risk elevates if you cannot hold for 10 seconds. So repeating it on both sides, hands on hip, leg out in front and holding that position. If you have to take your hands off, if your leg touches the other leg and rests on it, or if your leg drops to the ground, those are all where you need to stop the time. Okay, so we're looking for 10 seconds on each leg. The next position, as I alluded to earlier, is that heel to toe stand. So again, making sure you've got your balance support nearby. You're going to stand and place one heel directly in front of the toe on the other leg. You want to make sure that they're both pointing in a straight line. Often when people perform this test, we see them zigzag the feet like so. So we want a straight line between the 2. Again, hands either side and holding each position for 10 seconds, with the first being with the right leg in front and the second being the reverse, where the left leg is in front. So 10 seconds in either of those positions. Now, the next 2 tests are looking at slightly different components of balance. We're going to do a 5 times sit to stand, and that's going to look a little bit more at our leg strength and see if we have enough leg strength and power to prevent a fall. So what you want to do is make sure that you've got a chair that's right up against a wall so it doesn't slide out of the way. And we're going to time how long it takes you to stand and sit back down 5 times in the chair. Okay, now when you're standing up, ideally, because we're trying to isolate the legs, we want to make sure that you're not pushing up using your hands. So if you can, try to do it with the arms out of the way, so either across like so or across the chest, and doing it as quickly as you can by making sure that you're still safe and standing all the way up and sitting all the way back down onto the chair. Now you should be able to do those 5 in less than 12 seconds if you've got a normal or low level of falls risk. Once we get above 12 seconds for those 5 times, that elevates or indicates an elevated falls risk. And the final test is what we call a timed up and go. Now this is looking at your ability to walk at a normal pace, but also your ability to turn. These situations can obviously increase our risk of falling if we're unsteady on our feet. So what we're going to do this time, I'm going to move my chair a little bit further away. And this is probably the only one where you need to be a little bit particular and have a bit more equipment. You need to be able to measure out a 3-metre distance. I've marked out a little green point on the floor, which is 3 metres from the chair when the chair's in this position here. And what I'm going to do is I'm going to start by sitting on the chair. I'm going to start myself timing as soon as I stand up. I'm going to walk as briskly as I can around the marker, and then I'm going to stop the time when I sit back down. Now the easy part about this test is, again, that 12 seconds is the cutoff point. So you should be able to stand up out of the chair, walk a 3-metre distance, turn around and sit back down in that chair within 12 seconds to have a low falls risk. Once we get above that 12 seconds, our falls risk elevates substantially. Now, the reason I've given you this spread of tests is because, as I said at the beginning, Just being able to stand on one leg or heel to toe doesn't give us the information that we need about whether or not you've got that strength and that power in the legs, and also that ability to turn and be agile with your movements. So I hope you've enjoyed today's tip. Stay safe, stay active, and I'll see you soon for another quick exercise tip.